Everyone. It's been a little while since we did a COVID update. So today I just wanted to talk a little bit about what I'm currently seeing with this virus, this SARS-2 virus, and just talk to you a little bit about what I've learned over the last year. So, year and a half. So, first of all, I want to point out that we are still seeing patients that are contracting COVID. Most of them were indoors with family, or indoors on a plane when they contracted COVID, or they stayed in a house for a week with other people who had it. Um, it is essential to take care of a few things to make sure that if you're exposed, that you do not end up having post-COVID syndrome. Number one is your zinc level. Zinc should be measured using a plasma level, and copper should be compared to zinc. So we can't absorb zinc and copper at the same time. So what we should be doing is zinc as a plasma level and copper as a serum level in your blood. And copper should be about 10% lower than zinc when we measure that. We have a few patients that have discovered that they do have copper in their water or in their pipes, and that's why it's hard for us to get enough zinc in their body, because the copper is competing. So number one, if you haven't had that done, when you come in the office next, remind us to check that, me or Kristen. And then the other thing I want to point out is just stress levels. The people that I've seen that have developed post-COVID syndrome or have developed an autoimmune disease after getting this virus, they had adrenal dysfunction, their stress level was high, their anxiety was high, their sleep was not restorative sleep. So you can sleep for many hours a night, but it not be the best quality sleep. And a lot of times they didn't have good tools or access to great ways to lower their stress. So number one, if you have never seen a therapist, now is a good time. If you would like a recommendation for a therapist, a psychologist to see, I'm happy to give you one that would work best with you, because obviously Kristen or I knows you the best. I recommend EMDR for any traumas from the past. Some people do better with somatic therapy, and some people do better with energy work, and some people do better with a combination of these. In general, some sort of meditation or prayer, quiet time practice, journaling, all of this can help lower your stress level. We also know that just in general, having people to talk to helps. Eating healthy and avoiding alcohol and caffeine both help, all help. I realize that I sound like the party pooper. I'm not saying, don't go to that outdoor gathering where you're finally able to spend a lot of time with your friends. I think that's wonderful. I think that's what we all need right now and what your nervous system needs. Having said that, please be careful about excessive alcohol intake, as it can also be a sign of more depression or more addiction tendencies. Come talk to us about it. There's a lot of things we can offer to help. And then watch, more than a cup or two at the very most of caffeine a day, of coffee or green tea or black tea. Okay, the other thing I wanted to say is just, I still don't have like a blanket thing each person should do when they are exposed, or if they do get COVID, because it depends on you. It depends on what was your vitamin D level, what is your level of stress. Would you respond better to something like lemon balm or mint herb, or do you respond better to ivermectin? But in general, I'm using those. And then what's the level of gut inflammation? So sometimes biocidin helps. A lot of times IV ozone or IV vitamin C are hugely helpful. Knock on wood, we still have not had to send anyone to the hospital for COVID. And at this point, we've treated close to 75 patients. So I think that's really great. I also want to remind you that if you're interested in getting the vaccine, or you've gotten one but you need to get a second dose, please come talk to us, because Kristen and I are now very comfortable kind of assessing how your immune system is doing and where your inflammation is. And we can advise you on a specific vaccine, or we can ask you to hold off until we fix those. We are not against vaccines. We're not against any vaccines. However, we believe, just like with measles, mumps, rubella, just like with DTaP, just like with shingles, all the other vaccines we have out there, we believe that it is an individual decision and an individual conversation. It has to do with your toxic load, your genetics, the risk of you contracting that illness, and what would happen to you if you did. In general, a lot of our patients are at risk for developing post-COVID syndrome or developing an additional autoimmune disease if they did get it in general. But it's very hard to speak in generalities. I'd rather talk to each person and then we can decide if you need the vaccine. The other thing is that sometimes having had COVID and having those antibodies, which a lot of you now have, will protect you much better, we think, to these variants than if you actually get the vaccine. So please, let's test your antibodies and see that you still have antibodies from your COVID exposure, and then we can decide if you need the vaccine. This week, we're also going to finally launch our blog on the website, so I'll send that out when we launch that. And I'm going to write a specific piece about the COVID vaccine, so check that out. Let us know before you make any big decisions about vaccine or not, or if you get it, we want to hear from you right away if you start to have symptoms of COVID. And that's it. Stay well, enjoy outside time, outside activities, hydrate because it is hot, and I hope to see you soon.